I am Dr. Kechi Ogbuagu, a Nigerian, a public health physician for over 35 years. I have decided to leave my comfort zone and make this clip out of sheer anxiety, even desperation and fear, out of love for my people, for this wonderful country, Nigeria, that I love so much, for my brothers and sisters out there, and for people all over the world. The innocent, the poor, the vulnerable, who would bear the brunt of the ongoing pandemic. What I say and what I'm about to say is totally my personal views, my personal opinion. I am not aligned or affiliated to anybody. It is the words of a senior citizen who feels that she can no longer remain silent and watch the world she knows decimated. I would say almost reluctantly, decided to speak out of desperation, out of fear. Fear for my country, fear for my continent, fear for this world. All of them I love so much. Nobody, each and every one of us, nobody can afford to remain silent any longer. The ongoing global pandemic of the coronavirus has made it abundantly clear that we are one interconnected people. The whole world is actually one. Issues of geography, of nations, of state, of politics, of tribe, of races, of being white or black, all of them are totally irrelevant. We are one interconnected humanity. And yet, I am frightened, shocked, and saddened to realize that the world still hasn't quite come to terms with that fact. As we watch so many powerful countries struggle with the pandemic, I do not see what needs to be paramount happening for the world to defeat this war, a war that is indeed greater than the Third World War. We must address it as one. It must be coordinated, strong action by everybody. For the first time, we must realize that we are truly our brother's keeper. Let me say it again. I am calling, desperately calling, frightened for a strong, coordinated, global response. That is the only thing that will effectively deal with this pandemic. That is the only thing that will stop millions of people dying needlessly. Let me start with my home country, Nigeria. Let me also start by discussing Africa. As I speak today, Nigeria officially is recording, I believe, 35 cases of confirmed coronavirus, as well as many, many other there that they're trying to trace and so on. Actions are being taken. I'm not saying they are not. International borders are being closed. But the stark reality is that the coronavirus is here to stay with us. It is now a community spread epidemic. All the usual measures are important: contact tracing, isolation, quarantine, closing borders are important. But community spread is happening. It is a reality we cannot escape. This calls for a national emergency. The time is past for uncoordinated action. Why? I think Africa needs to realize that our response to the epidemic, to the pandemic, must of necessity be different. We see it happening. We see global powers on their knees fighting to save their people. Italy, Spain, the US, UK, I can go on. Those powers have a chance. They have systems, they have healthcare systems and economic systems that they can rally and put into place in this emergency to save their people's health, to save their economy. Despite that, many of them are plunging into recession. Many of the health systems are overwhelmed. In Nigeria, in Africa, we have nothing. Our health systems cannot cope. We know that. And the transmission is bound to be also different. WHO is prescribing and advocating wonderful measures. Wash your hands, sanitize, social distancing, great. But those measures need to be modified, strengthened, shaped, adapted for Africa. 70 to 75%, even 80% of our communities are rural. They don't have running water. They don't have the luxury of several hand washing under a running tap. A large proportion of our population live in overcrowded conditions. We do not have the luxury of self-isolation. Not when there are 10 of you living in 1 or 2 rooms. Our conditions of work make it almost sometimes impossible to social distance. Our public transportation systems that are overwhelmed and overcrowded. Our markets that are death traps, where hundreds and thousands are working together in very confined spaces. Our people that are so poor that their nutrition and health is already a risk factor. As the epidemic continues to spread in Africa, there's every probability that our response will be worse than what we have seen already in the developed countries. Nigeria, my beloved country, I love this country so much, hosts 1/5 of the population of Africa. We have approximately well over 180 million people in this country. The epidemic is spreading. Let nobody tell us anything else. When it begins to decimate 180 million people in this country that is Nigeria, it will bring Africa to its knees. our response has to be strong, coordinated at the highest level. We should have, even before now, declared a national emergency. Every state in this country must be responding in the same manner. The virus knows no state boundaries. If it is in Lagos and rising rapidly, it is everywhere in this country. Anything less than this knowledge is deluding ourselves. We need to begin to do what we can. We need to buy time, slow this transmission so that we buy time to put the facilities we don't have in place. Where social distancing is possible, let us begin to do that. Markets, for instance, need to close. Those who can work from home, work from home. Gatherings totally stopped for the next few weeks. We must delay the transmission. Hand wash instructions we need to help our people, our communities to adapt it to what they can do. For instance, build buckets with taps and make it freely available to masses of our people in the urban areas and in the communities. We need to come and produce hand sanitizers and share freely. People cannot afford to buy. A great deal of my talk will be centered on the health aspects because that is my area of specialization. We must speak with one voice. States should not be doing their individual thing. Leaders at every level need to be part of this coordinated effort. Whether they're religious, whether they're community, whether they're leaders of thought, leaders in government, leaders in the private sector, all hands on deck. The pandemic is here. The epidemic is here. Whether we like it or not, the only way forward is an understanding that we're facing a national emergency. I say the same for Africa. Our nations are artificial boundaries drawn up by our colonial masters. There should be a strong, coordinated continental response. At the highest level, African Union must truly show its leadership. Heads of states must be addressing this themselves. No country in Africa is safe if its neighbor has a raging pandemic. No amount of border closure is going to work. Africa is likely to be more devastated than any other continent we're seeing in the world. Africa must come together and act as one. We must reach out to our weaker countries and neighbors and deal with concern for their own epidemic as if it is ours, because it is ours. This epidemic knows no boundary. For the global world, for the global powers, I say it's a huge tragedy that the global stage was set even before this corona epidemic in such a way that usual concerted global action that we see was greatly undermined. And yet we have no time. We no longer have time to blame. to blame the US, to blame the UK, to blame Germany, to blame China. There's no time for blame. We have a crisis. We have a global emergency. Northern powers must come together. In my humble opinion, the powers in the North who have the resources and who have been able so far to limit the spread within their countries owe their neighbors a duty to reach out, even to reach out to huge global powers like the US and say, what can we do to help? Because this is now a common humanity. If there are a shortage of test kits and so on in the US, then perhaps if Portugal doesn't have such a big problem and Portugal can produce them, this is the time to reach out. The North must realize that they can never solve the problem in their world, in their corner of the world, if the virus takes root in Africa and they do nothing about it. We will all collapse together. As long as it continues to be endemic and prevalent in Africa, none of the northern powers can ever say they have truly protected themselves. Their borders cannot remain closed forever. Their economies would crash and continue and remain there. We are sharing for the very first time a common identity. To the World Health Organization, I say, bravo. For me, that is perhaps where I've seen a real attempt at global leadership. But it is global health leadership and can perhaps only remain that. I am particularly proud of the Director General of WHO, Dr. Tedros, who I had the special privilege of working with many years ago in Ethiopia when he was Minister of Health. A wonderful man. He's demonstrated amazing leadership. But I call on him now for Nigeria, for Africa. And I say to him, the wonderful WHO recommendations so far don't cut it enough for this continent. When all is said and done, you are a son of Africa. Your lineage is here. Your people are here. You must work hard with your team to adapt the recommendations for the corona to ones that can work more effectively in Africa. Africa needs a different response. To the United Nations, from which I retired, an organization that I love and have a great deal of respect for. I feel, again, this is my personal opinion, that you need to do more. This is the time in history where you, more than any other time, justify your very existence. You need to facilitate this global coordination that we're talking about. You are the one platform that can provide a meeting and a prompt meeting place for all the world leaders. The world leaders must take on this global pandemic as their highest priority at this time. And the United Nations needs to provide, advocate, and ask for more and more of that to be done. I will come back to my home country, Nigeria. What we need to do as we declare a national emergency is to do everything we can to delay the rate of transmission for two reasons. One is to buy us time to get ready to face the huge casualties of this illness. build emergency hospitals, begin to source around for test kits and everything that is required, find face masks, health personnel, begin to train, begin to recruit more if possible. We need time to put these emergency processes in place. I call on all our indigenous philanthropists in Nigeria and in Africa. Nigeria, for instance, can boast of perhaps the richest man in Africa and the richest woman in Africa. I was proud to know that Dangote was already helping the global efforts. But charity must begin at home. There is so much at stake. We have a choice. The world has a choice to recognize our common humanity, to take on this war as allies, as brothers, or to continue doing our own thing, laying blames elsewhere, delaying because we think we want the world to think we're already on top of it. But how this continues to unfold in Nigeria, in Africa, all over the world, will depend on whether this global, strong, coordinated response happens. If it doesn't, posterity will judge us. May the good Lord help our world as we know it today to survive. God bless you all.